Hello friends, and welcome to another episode of Better with me, Charlotte Wager Hall. I'm also known as Skinny Schedule, and you can find me on all the social media channels, so please like and subscribe. On today's episode, we have Kimberly Shepherd, who is the owner of Urban Acupuncture. In today's episode, we talk about what acupuncture is, how it works, and who benefits from it. You get to see a live demo on me as a guinea pig, and we talk about how acupuncture can support conception and those going through the IVF cycle. This is a huge movement and is getting more recognised by fertility clinics. So stay tuned for another amazing episode. A big welcome onto the show, Kimberly. So a big welcome, we have Kimberly Shepherd, who is the owner of Urban Acupuncture and an acupuncturist yourself. So many questions about this topic from myself and my followers as well. So firstly, how on earth did you get into it? Because it is quite a random sector.
So I think it's actually growing in popularity, to be honest. And it's becoming a lot more integrated into the West. And really, that was one of the things I knew I wanted to help people. I knew I wanted to work in the health industry, but I wanted something that had legs from an integrated health perspective as well. So I guess my story behind really getting into it was because I was diagnosed with interstitial cystitis when I was...
Sorry, what was that?
Interstitial cystitis.
Okay,
so it's an inflammatory bladder condition.
Right, okay.
When I was 19, apart from the diagnosis, the symptoms started then. Diagnosis wasn't until much later. And I was put through the Western medical system, and there really is no cure when it comes to something like that. It's about management, but they, thought it was repeated infections, and it wasn't. So I was put on long-term antibiotics for over a year.
Which is horrendous for your gut health and stuff as well.
Yeah, precisely. And overall general health, but also it was debilitating because these symptoms were constant, and I was getting no help. Painkillers wouldn't do it. I couldn't leave the house. My social life was absolutely slim to none.
So did it feel similar to cystitis, but extreme cystitis?
Constant, yeah. Passing blood.
Oh my
blood
goodness.
Clots. Oh my gosh, it was awful. And so what happened was I started looking. My mum's a nutritional therapist anyway, so we were obviously working from a nutrition perspective, looking at generally alkalizing foods just to help reduce any of the inflammation. But it wasn't until a friend of mine really got me into this idea that there were other mechanisms out there. And that was really the first experience that I'd ever had having acupuncture.
And so what made you decide acupuncture, the jump to acupuncture?
Well, she worked in the clinic.
Okay,
and she was
so
like, this could be really good for you. Yeah, exactly. So I went there, had no expectations. Again, it was very much last...
Chance alone.
Exactly, precisely, yeah. Because I tried everything else. I tried surgery, no change. And the last thing they suggested was having like a bag, like an external bag. Because they were like, if your bladder, is full of adhesions and it's got all this inflammatory condition and you physically can't hold, then really that we'd have no other options. So I was like, holy shit, I need to figure something else out. So I went to an acupuncturist, and it transformed my perspective, not just about health, but also obviously it really helped with the pain condition. But it was the philosophy that kind of drew me in more than anything else, because within acupuncture, we're looking at the whole person, and rather than an isolated condition. And really that in Western medicine is quite reductionist in that respect. So what my practitioner at the time introduced me to was this connection between our whole self. Everyone bangs on about this kind of mind-body connection, and really that's kind of what the principles of
There's
Chinese
more coming
medicine.
out about there, isn't there? The reason why you have physical, like butterflies when you get nervous and excited, there's connections between the mind and the body.
There's huge connections
as well,
from a neurological perspective. Western medically people talk about this the whole time, how neurologically things do impact us. Our stress response impacts every aspect of our physiology. But yeah, exactly. They don't look at that aspect, and that's what my practitioner allowed me to do.
So did you go along and they started you like once a week, twice a week? Like how did it start for you?
Once a week initially, although I think it probably should have been more
often. And then how long before you started seeing an improvement?
So for me, it was probably around about treatment 5 to 6 where I really started to see some things got worse before they got better. But yeah, it was around about that time that things started to improve. And it was constant work because at that time my bladder had got into a habit, and so often is the case with our bodies that we get into these habits and pain habits, holding habits in our bodies. Because I've been going through this for 18 months to 2 years. So I knew it was going to be an instant fix. And it was that really that started me on this trajectory. And I know that it definitely wasn't the only thing that helped. And I'm not a believer of the one-size-fits-all thing.
But it helped. And I think when you're that desperate to the point where you might have had to have a bag, and you found something that helps along with other things. I can't. So how long would you say before you trying to find a way to felt it was more manageable and the pain had reduced? So it took about 5-6 treatments to see an improvement. How long was the time frame before you saw quite a significant improvement? You thought, wow, there's something in this. Something is definitely working.
Around about 6 months.
About 6 months. And you were going once a week for around 6 months.
Yeah.
And then then you were like, wow, this is amazing.
And I was doing obviously everything nutritionally. I was having talk therapy as well. As I said, it's a multifaceted approach.
Definitely.
I'm a big believer of that. But just from an acupuncture perspective, it allowed me to open my mind from their philosophy of health and how we approach health, that really kind of facilitated that change for me. Yeah.
Absolutely. So you then actually decided to go and train to become an acupuncturist. It doesn't feel normal saying that yourself. And it's actually a 3-year degree, which I had no idea about. Mm-hmm. So is it 3 years just focusing on acupuncture, or is there other things?
No, so it's a 3-year BSc, just solely doing acupuncture. But
I've never heard of that. I would have thought it was, and I'm not discrediting it anyway, but because I don't know much about it, in my head it was one of those things you might do for 12 weeks, but actually to do it, and which university did you go to? So
it's a bit of a weird one. It was the Northern College of Acupuncture in York.
Right, okay.
It's accredited by, or was accredited at the time by, Middlesex University, which is sister university with Beijing. So it's kind of a little bit of all things, really. It's a bit of a strange one. But it is a 3-year degree.
And could you study that at like a red brick uni? Not that I'm bothered about different unis, but is that at mainstream universities as well?
Not at the moment, at least not here in the UK. Yeah.
But it is in other countries, so they're obviously recognising something.
Yeah, it's huge in other countries. America, obviously anywhere in Asia, Australia.
So it's huge. And it's not on our NHS system, is it? Yeah.
It is.
Oh, it is. It is available in the NHS. Mm-hmm. Is that more the postcode lottery, which I'm sure you don't... I'm not trying to get you into any corners, but I didn't think it was available in the NHS.
Yeah, it is for certain health conditions. So NICE guidelines explain that it is available for pain. So back pain's kind of been ruled out at the minute, but I think it is now migraines and something else, knee pain or something like that.
Okay, so there are a couple of conditions. So they know there's some standing in it. So if only the NHS realised how powerful it is. Because who benefits from it? So who would you suggest if they were having any sort of problems with any part of their body? Like, who benefits from acupuncture? What sort of conditions? Or
Yeah, so it's a really difficult one to say, because really what acupuncture is trying to do, one of the mechanisms or primary mechanism behind acupuncture is that actually it has got this self-modulating, self-regulating mechanism that it has on the whole body. And so it, rather than saying it heals specific things, it helps with so many aspects of self-healing within ourselves. So just simply, I mean, that's it as a broad spectrum, brilliant mechanism for bringing everything into balance. But there's been lots and lots of research into pain, which is really common thing to go
and like
for.
chronic pain,
acute pain, yeah. In cycling, for example, on the Tour de France, they use it a lot within their teams for immediate post-race recovery. So again, it's not just chronic pain, but it's also acute injuries as well. So that's it from a pain perspective. But also, as I love to work with, is the more hormonal women's health perspective as well. So yeah, headaches from a pain perspective as well is really, really common one. But yeah.
So how does it work? Because when someone says, I can put lots of needles in you and you'll have an improvement in X, Y, Z along with other things, how does it work? And I believe you brought a needle in to show as well, because that'd be quite interesting.
Yeah. So, I mean, it's complex, as I said, because we're working from a whole body mechanism, self-regulating, self-healing. But if you kind of, in the way I describe it to patients, if you really narrow it down, we're working with these fascial planes in the body, and it's really the blueprint of our body as well. Fascial planes is what surgeons use to cut people open quite nicely.
Okay.
And that's what keeps everything in place really as well. And along these fascial planes, we consider them like highways of messengers. So that's where all the electrical signals go up from our nervous system. It's where all our hormones go up from our endocrine system. So really, as soon as we tap into that highway, we're tapping into this really powerful mechanism within the body to start molding and manipulating how that stream of messengers is firing and where we can direct that to. So that's how, or what we're trying to work on. How it works, and with that specific concept, is really working with blood flow. And so we can actually stimulate blood flow to certain areas. Because as soon as you create, it's causing a micro trauma. So as soon as you create a little micro trauma on the body, whatever you do, you send loads of blood flow to the area, because it's almost like us asking the body to investigate that particular part. So the body goes, oh gosh, what's going on there? Sends loads of blood flow to the area, and our blood has everything that we need anyway to self-heal. It's got all our
that makes sense. Everything you say makes sense. So it's nice hearing it from that way. It's quite clear when you say it like that.
Yeah, it's got all our inflammatory markers, so it sends stuff there, and it helps reduce inflammation in that respect. It also releases lots of endorphins, so it really helps with, again, the pain response. That's kind of how it works from a very...
So if I've got something like, I get lower back pain, and I think I know where it's from. I think it's from where my shoulders gets dislocated, so then I think I reposition. So does the needle go where the pain goes? I don't think it just does it?
No. So it doesn't. Absolutely not. Generally speaking, when there's an acute pain response, sometimes we might do it like that. When there is more of a chronic pain response and the body's got trapped in certain holding mechanisms and habits in the body, and we're aiming to reduce inflammation in certain parts of the body. So in that respect, the posterior chamber, really the entire lower back area, we're working with the lower arms, lower legs predominantly. So we call it distal acupuncture. And the way that we kind of best describe that is by... one of my mentors described it like you don't go immediately to a light and turn the bulb in order to facilitate that light to come on. You rather get the same powerful response from just switching a light switch. And the same happens within our body as well. That electrical signal doesn't need to be that kind of immediate location. We can just simply flick a switch from a lot further distance to facilitate the same response.
Yeah, that's the end of the line, I guess. So you need to work back from the start of the line.
Exactly. And there's also a lot of neurological studies that demonstrate the way in which our brain interprets our peripheral nervous system. I can't remember the name. predominantly because I've never been able to pronounce it, so I'm just going to leave that one. But basically, our brain considers our hands and our feet, our lower legs, our lower arms, to be these huge things, and place significant importance on them, because that's where all our sensory stuff is. That's where we're touching, feeling, moving, and so the brain sees these areas as these huge things, and if we work on that particular area, then we gain a significantly greater response to the rest of the body.
It makes sense. And everything you're saying, like, the more I do these and the more research I do, everything comes back to inflammation. Like, do you follow Dr. Rhonda Patrick?
No.
She's a nutritionalist, or I don't know if she's classed as a dietitian, but she's fantastic. If you listen to some of her stuff and about like time restricted feeding and like sauna use as well, it all comes back to inflammation and reducing the body's inflammation. But I think you'd really interest in that.
Yeah.
So can you show us what the needle looks like and how big it is? Because I think there's a lot of people that would benefit but would be scared because it looks scary. From an outsider who's never had it, it looks scary.
So, I mean, a lot of people do come who are quite scared of the needles.
Needle phobic.
But yeah, as soon as they have it, they are complete converts. So it really is...
How big is it? I feel like you're going to pull out a really big needle and you're trying to make me feel comfortable.
No. So acupuncturists...
Okay.
Only use relatively small needles. If you go see a physio, they would use significantly larger ones, which is completely...
That is a good tip.
unnecessary. So these needles... despite how long they are, typically only go in maybe a centimetre or 2 max.
And should it hurt?
No.
So that's the key thing, isn't it? I think if you're going somewhere reputable, it shouldn't hurt when you're having it. So how big is it?
So this is just an example of a relatively small needle.
And if you can just sort of like hold it up to that one there, just so we can see.
Okay, so it always comes in a guide tube. I have to say it always comes in a package as well, so that it's always single-use sterile needles that we use here in the UK as well. And yeah, so this is really what it is. This is the guide tube, and we use that simply to just help create some placement with the needle. But this is the actual...
So it's not that big. Do you want to put it in my hand or something? We can show how it goes in. I'll just move my mic forward.
So it's less than a hair width in size. So it's less of a needle, more of a... in fact, less of a pin. It's so minuscule. Do you want me to move this?
You can probably move it with you. I'll lean over, so that'll be easier for you. So this is demonstrating how it goes in.
This is just a really common point that we use in lots and lots of different things.
I'm going to look away though.
Just take a deep breath in and out. Okay.
Is that it?
Yeah.
That literally was nothing.
There you go.
I've had worse from... That's not even like paper cut level. That literally is like a tiny scratch. There's literally nothing. So how long? So you'd cover different... I'm not going to be able to correct it. Those points. I was going to say facial.
Acupuncture points.
Acupuncture points. Yeah. And then how long would they be left in for?
They say that chi circulates around the body every 28 minutes. So typically we would leave them in for about 28 minutes. My treatments tend to last about 45 to just allow for that kind of time. But anywhere between 20 minutes and an hour, it really depends on what condition you come with. And some points are even just in and out. So,
wow.
Yeah, and we don't use many either. Again, if you're hitting the right spot, which is obviously what trained acupuncturists would be trying to do or know how to do, then we may only need 10, 12 needles to facilitate a healing response in the body.
That's not bad, is it? And do they hurt coming out as well?
No. There you go.
There we go. I'm really pleasantly surprised at that, actually, just how fun it is, because you see all these things on TVs and movies, like these huge needles going in.
Yeah.
And like, even if you had a needle phobia, there's no way. That's like so fine. It's like fine as a hair.
Yeah.
So I know so how often would you expect someone, I remember you saying that, well, you said earlier that you had 1 treatment a week, but actually you would have benefited from 2. Is that the recommendation, around 2 treatments a week?
It depends what for. So there's lots of factors with it. There depends how long the condition has been.
Yeah, so the longer the condition you'd expect, the longer the
absolutely. if it's a congenital thing, so, if it's something that you're kind of predisposed to from birth, or familial or anything like that, or if it's just an acute issue that you need a little bit of help with, you probably wouldn't need to work as much.
So it just depends, and you can
it
treat
really
it
just
for that.
depends.
And is there any side effects from it?
No side effects, no.
So you can get back in your car, you can carry on your day as normal. There's no sort of downtime or anything like that.
Well, the only side effect is, and I always tell my patients as well, that you might feel a little drowsy. A lot of people say that they feel quite spacey, quite sleepy.
Relaxed, surely.
Yeah,
I imagine if you
precisely.
put somewhere and you lay down, you've got some calming music on. You tell me to lay there for 28 minutes. I'm probably having a nap, so that
Most
makes total
people
sense.
are having a nap during the time. And again, because of the mechanism of acupuncture, reducing the stress response in the body as well, and having that neurological impact as well, stimulating things like serotonin, dopamine, which are our natural happy hormones. People just flop right on the bed and feel fantastic after as well.
I don't know if it's psychological, but I feel more relaxed. I don't know why. So one of the real reasons, I think it's really good to talk about lots of different ways to improve your health, and particularly coming up with inflammation and things. One of the biggest things that made me want to have this conversation with you as well is in our community, in our area, I've heard a lot of people having success through having acupuncture to help with IVF or conception. And it's really interesting because I'd never really heard that before, but now I've heard quite a few stories. I have had a lady on the show who's had IVF, and she'll be back on talking about like the birth and stuff. But that was something I really wanted to cover, about how acupuncture can help with conception, and particularly if someone's going through the IVF process. Because I think I read on your website that it can help increase chances by as much as 60%. And which is huge. And I imagine if someone's going through that, and it might be something that could help, that's natural and not harmful, it might be worth looking at. So can you tell us a little bit more about that?
Yeah, so firstly, 60% is 6% in total. So, for example, if you're going through IVF, then success rates tend to be between 20 and 40. Acupuncture can increase it by 15 to 20% in
That's
addition.
That's a huge rate, though, isn't it? That is a huge rate. If you're going through that and you've had more than one cycle, then it's something to look into. It's not to be sniffed at.
Absolutely. And so, again, what we're trying to do, and making absolutely no claims. This is
no,
100%.
And I hope it doesn't come across that I am.
No. Again, something I always tell my patients is that actually we can't create baby. Only the fertility doctors can do that. What we can do is create the best possible environment for conception to take place by working with the health of mum, and therefore then eventually the health of baby, health of pregnancy, and then health of baby as well.
That makes sense, doesn't it?
Yeah, exactly. And I always consider it to kind of creating the fertile soil in order for that to be able to grow. Yeah. And so typically what we do when we are working with acupuncture and fertility, we're always looking to work with the patient maybe 3 months before, simply because that's when the lifespan of an egg anyway, the follicle that's going to grow and then develop into an embryo. So we're looking to get it from its little seed, and then keep just providing it with lots of blood flow, lots of nutrients, working with the ovaries, as I said, stimulating lots of blood flow to them, so that they're fed with and all the nutrients they need and grow to their best possible potential. So that's what we're looking at doing over the course of the 3-month period. And then after that, some people go on to conceive naturally. If not, I work with them throughout their IVF or IUI or ICSI cycles as well. And there's lots and lots of research out there that has studied kind of the effects of acupuncture alongside those fertility treatments too.
That's it. And is that something that fertility clinics are talking about? Yeah,
loads. More so in America, Canada, where, private healthcare is just part and parcel. So it's just an addition that can help them get the stats that they're looking for. In the UK, it's changing, but there isn't that level of integration yet from an NHS perspective. In the private fertility facilities, They are integrating it more and more. So it's getting there.
I think it's raising awareness, isn't it? And I think if someone is maybe going through that, and like you said, I think that's a really beautiful way to explain it. It's like getting the soul ready for that, and it's putting the work in, because it makes complete sense. And if that does help someone out there, so if someone was doing that 3-month, say, cycle, would it be about twice a week visit or once a week visit?
Depends what's going on.
Okay.
Yeah. So, for example, my endo patients or PCOS patients, I like to see them a couple of times a week, kind of minimum. If you're just coming for, if you've got unexplained infertility, which, is not.
Which I do have friends that have, and that's why, again, it's really nice to have this conversation.
Yeah. And generally speaking, their hormones are relatively stable. They're just working with the stress response, working with, again, just making sure that body is in the best possible states for pregnancy, then maybe once a week, but always working with their cycle. So tweaking and changing the treatment according to where they are
that makes sense.
In their cycle as well. Yeah, because if you think about it, at the beginning of the cycle, what we're doing is working with egg quality. At the end, what we're doing is working with progesterone, so stimulating lots, and it's a lot more fiery side of the cycle as well. So we call it the yang phase of the cycle. So it tends to be that much more heated, much more supported, much more energetic aspect when there could be a potential egg implanting as well. So creating a really, really solid endometrial lining during that latter stage.
So how would your acupuncture differ during at which point of your cycle?
So, without getting into too many mechanisms,
in a simple way for me.
So again, we can really define it into the yin phase and then the yang phase, working with blood flow to the ovaries, working with that very nourishing yin energy, I should explain, is or a yin treatment is working with estrogen.
Okay.
And that estrogen
yang is progesterone.
Yes, precisely.
So would it change the location of the needles?
Location of the needles, again, lower arms, lower legs, simply to stimulate that really, really powerful
So it wouldn't
response.
change regardless of the point of your cycle?
We would always be working with abdominal points during the yin phase, again, just trying to get as much blood flow.
And what about the yang phase, the same?
Less so.
That's it. It's just seeing that, so, and this you'd expect this you'd expect this. So if someone's sat here listening and they're thinking, actually, I could maybe I have chronic pain, like I know it's really good for endometriosis, it can help. How would they know someone is certified or it's a good clean clinic where they use nice needles? Like, what would you be looking for?
So only in the UK, only go to an acupuncturist if they are a member of the British Acupuncture Council.
Okay.
It's the only way to know that if people have gone through significant, so it's a minimum 3 years degree level training if you want to be part of the British Acupuncture Council. And
how might would that be on their website?
It's acupuncture.
.co.uk.
Acupuncture.org. Acupuncture.org.
There's a way of searching it to see if someone, so you can literally put in your
postcode. You put in your postcode and it comes up with a list of acupuncturists, that are available and located quite locally. If you wanted to get into the more fertility side of stuff, you'd also be looking to see if they are registered with the Acupuncture Fertility Network as well.
Oh, so it's like another...
It's a subset.
That is interesting. So I imagine that's like with my audience, I know a lot of them are going through those stages. So I think that'd be really useful for them. So finally then, ending on, what is your formula for success?
My formula for success, again, simply because of my experience with kind of women's health issues, and I never look at acupuncture just being the one and only thing that's going to facilitate the change or get the patient where they want to be. It's an amazing, amazing modality, but I always work from an integrated perspective as well. So always looking at what else can be done, be it, self-care stuff, or be it referring also to other practitioners who I work with.
It's a holistic approach, isn't it?
Precisely, yeah, absolutely. And so that's really where I I feel like my success, shall we say, excels simply because of the fact that I'm not like, oh, it's all me, it's all acupuncture. It's actually looking at it from a multidisciplinary perspective.
Brilliant, thank you. So where can people find you?
On my website is Urban Acupuncture Sheffield.co.uk.
Yeah. And what about on socials?
Social, gosh, you're testing me. Instagram is urban.acupuncture. And Facebook is urbanacupuncture.sheffield.
Oh, yeah, and we'll tag those up as well. So thank you so much for coming on. And I sort of want more of these to help me go to sleep. Thank you very much, Kim.
No problem. Thanks so much for having me.